Lots of people in BC assume that healthcare is completely free, but that's not always the case.
So today we're going to be breaking down two important things you should know about the Medical Services Plan and Fair PharmaCare.
First, let's talk about MSP, the Medical Services Plan. MSP covers medically necessary healthcare in BC, including doctor visits, hospital care, most blood tests, x-rays, and other tests, but MSP does not cover prescription medication. If you are 18-year-old or less and already live in BC for more than 6 months, you probably still are under your parents' MSP. But this coverage will end when you turn 19 unless your parents have made arrangements to keep you under their account. To stay covered under your parents' MSP, you will need to meet these criteria. If you are not eligible to stay dependent, MSP will set up automatically a new account for you. If you recently moved to BC, you need to apply online. There's usually a waiting period before coverage starts, so apply early.
So if MSP doesn't cover most medications, how do people pay for them? That's where Fair PharmaCare comes in. Fair PharmaCare is a BC government program that helps pay for prescription medications based on your household income. In general, the lower your income, the more financial help you may receive. If your family has Fair PharmaCare, you will be covered under that as long as you are a dependent. If you are not a dependent, you need to contact Health Insurance BC to establish your own coverage. If you are new to Fair PharmaCare, you need to apply online yourself. Registration is not automatic. To do this, you also need to have a BC Services card with photo, social insurance number, and have filed your taxes. And note that processing can take several months. If you need help filing taxes, there are free community tax clinics available through the Government of Canada. Before Fair PharmaCare starts contributing, you'll usually have to pay some medication costs yourself first. That amount is called your deductible. Once you reach your deductible, PharmaCare starts covering part of your medication costs.
For some key messages, if you're approaching 19, verify if you fit the criteria to stay under your parents' insurance. If you don't fit those criteria, contact BC Health to set up a separate Fair PharmaCare coverage.
Thank you so much for watching. Just remember that coverage may take time to activate. Fair PharmaCare and MSP, however, still don't cover everything.
And next video will cover how extended health benefit and drug companies can help you fill the gap.